It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question in this series of questions from my client Sue. And the question last week was part 5 of my dad has end-stage HIV and is on ECMO in intensive care. Can he have a lung transplant? And that's part 5, or that was part 5. You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of my clients, Melissa, which are excerpts from phone and email counseling and consulting sessions with me. And the question this week is, my 78-year-old mum has lung cancer and developed an infection. She's in ICU on the breathing tube. Can she get off it, or will she need a tracheostomy? So Melissa writes in, and she writes, "Hi Patrick, I'm Melissa and I was happy to find your website as my mum is in ICU. I have a few questions. My mum has lung cancer, but it hasn't spread, and she's in intensive care because her blood pressure dropped suddenly and she couldn't breathe. They think it was an infection. They have her blood pressure stabilized now, but she has been unable to breathe on her own, and the breathing tube has been in for about 11 days. They first pressured us to pull the plug, which was not an option in our mind. She was heavily sedated, and they told us they doubted her pressure would stabilize or that she would wake up, know us, or recognize us. They were wrong. Her pressure has stabilized. She's awake, off all sedatives, fully whole and aware, and knows everything that's going on. She just cannot breathe on her own, and we have no idea why. They are telling us her muscles around her lungs are weak, and since it's been almost 2 weeks now and she shows no signs of improvement, they doubt she has much chance to breathe on her own. Also, she's older, has cancer and has issues like Lyme disease, and has also had C. difficile. They are pressuring us to do an immediate tracheostomy. They say the longer we keep the tube in as is, the more risk for an infection. They want to do a tracheostomy, and at this point they tell us there are few alternatives. They say with the tracheostomy she'd be more comfortable and might be able to speak after rehab, and it's much less risk of infection. They also say a tracheostomy is low-risk surgery. But where she'd go after is an issue, as there's only 1 or 2 places in the state that take people on breathing machines. We don't want her out of the state, and we are afraid she will get very depressed. She still might, as she's getting impatient and trying to talk. She could possibly come home, but would require 24-hour care with ICU nurses, and that could cost us $250,000 a year at least. The doctors told us, quote unquote, only very rich people can do that. My mum knows nothing, yet she's trying to talk and getting frustrated. My mum is 78 and she didn't have chemotherapy treatment up to this point. She was not a candidate for the chemo, so she had Opdivo instead. Unfortunately, it had side effects, and that's one of the reasons she got so weak. She developed C. diff, colitis, and bruising. They had to stop the Opdivo because of it. Her cancer has not spread, and I think it's at the stage 2A. It's a small tumor, and the Opdivo did shrink it. The hospital told us to treat the cancer as a secondary issue right now. Her other medical conditions include chronic fatigue, Lyme disease, and spinal stenosis. She was originally admitted to the hospital for the flu, which she got over. She was doing well when her blood pressure dropped initially. Her stomach blew up and rapid breathing started. She's been on the breathing tube, as I mentioned, for about 10 or 11 days now, and the pressure is stable and she's awake and alert. I don't really know what to do. I feel hopeless. On the one hand, we are lucky because we have her and she's alert and the tumor has not grown. We just found out. On the other hand, I'm afraid my mum will freak out at hearing she may have to go to another facility. I'm worried she will get worse, and the hospital seem to be rushing us. They said the longer she does nothing, the more the risks of a quote-unquote catastrophic event. I so want her to breathe on her own. Every day they try her, and every day she can only do a few minutes. I would welcome any advice you have about anything I have told you. Sincerely from Melissa. Now, before I answer Melissa's questions, if you want one-on-one counseling, consulting, and advocacy with me, please check out the counseling and consulting options on the top of the website. I offer email, phone, and Skype counseling and consulting one-on-one with you if you have a loved one in intensive care. So here is my response for Melissa. Hi, Melissa. Thank you for making contact, detailing your mum's situation, and also for using my one-on-one phone, Skype counseling and consulting and advocacy service. I very much appreciate it. I'm very sorry to hear your mum is in such a difficult situation. I have seen many patients over the years in intensive care struggling with breathing when lung cancer is getting progressively worse, and then patients often end up in intensive care on the ventilator with a breathing tube. Furthermore, the Opdivo most likely made your mum worse, and that's how she became weak and ended up with an infection, leading to her drop in blood pressure and leading to her ICU admission. I'm very pleased to hear that you didn't buy into the negativity of the intensive care team and that quote-unquote pulling the plug was never an option for you and your family. Whilst I'm very supportive of a tracheostomy for the right patients at the right time, there are a number of issues you need to be aware of when it comes to a tracheostomy for your mum. A tracheostomy in intensive care in most hospitals in the United States can be a vehicle to discharge patients into long-term acute care, also known as LTAC, rather than focusing on weaning patients off the ventilator in intensive care in the first place. From my experience, any intensive care unit is much better equipped to wean patients off the ventilator and the tracheostomy than any LTAC. Unfortunately, intensive care beds are in such high demand that a tracheostomy is being done on some patients to empty their ICU beds quickly and send patients onto LTAC without informing patients and families about the implications, drawbacks, etc. In some cases, I have seen patients being discharged to long-term acute care within less than 48 hours after they have had a tracheostomy, without patients and families being informed what it actually means. Well, think about it. The term long-term acute care facility implies long-term care. And I know from experience that long-term acute cares are not as skilled in weaning a patient off the ventilator and the tracheostomy compared to the skills and experience of the staff in intensive care. Also, in your mother's situation, I understand that there is no LTAC in your state. Therefore, sending your mother to another state with potentially no or limited family support, from my perspective, is highly unethical. And of course, your mother would get depressed if you and your dad wouldn't be around. Therefore, the first issue you need to look at is if the intensive care unit has maximized their efforts to avoid the tracheostomy in the first place, and if they try to get your mother off the ventilator, off the breathing tube, and extubate her. Many intensive care units do not openly share when and why a tracheostomy needs to be done. And unless you have done your own research when and why to do a tracheostomy, and unless you're making sure the intensive care team has absolutely maximized their efforts To get your critically ill loved one off the ventilator and the breathing machine and the breathing tube in the first place, you should not give consent if you are the medical power of attorney or the next of kin for your mother. Now, in order for you to make an informed decision, have peace of mind, control, power and influence when it comes to getting your mother off the ventilator and the breathing tube in the first place, I would suggest you check out another article and video that I made about how to wean a critically ill patient in intensive care off the ventilator and the breathing tube. So I have put a link to this article and video below this video in the written version of this blog, and you can click on the link to this article and video there. If you're watching this on YouTube, just click on the link below the video. It'll get you to the website and all of the appropriate resources. So next, Melissa, to look into doing a tracheostomy or not, I also put some links to other articles and videos below this video. So you may want to check out how long should a patient be on a ventilator before having a tracheostomy. You should also look at how long can a breathing tube or an endotracheal tube stay in. Or you may want to look at the article and video, why would a critically ill patient in an induced coma need a tracheostomy in intensive care? And you may also want to look at what are the risks and benefits of a tracheostomy. Furthermore, do not respond to the pressure the intensive care team is putting onto you and your family to agree to a tracheostomy unless they have absolutely maximized all their efforts to get your mother off the ventilator and the breathing tube in the first place. It's a very good chance that as soon as your mother does have a tracheostomy, she will end up in long-term acute care in another state. Again, long-term acute care once again stands for long-term acute care, and it implies long-term care. You certainly don't want long-term care for your mother, but what you want is short-term recovery if possible at all. Unless you start asking the right questions and you don't respond to their pressure points, but use your own pressure to push back on the intensive care team, they will do whatever they do, with 99% of the families of critically ill patients in intensive care who make no informed decisions, have no peace of mind, no control, no power, and no influence. You have taken the first step already by not agreeing to quote-unquote pulling the plug or withdraw treatment, and good for you standing your ground. And if you are watching this, and if you are in a similar situation and you feel pressure to agree to a withdrawal of treatment or quote-unquote pulling the plug, or if you have already agreed to it and you now have second thoughts, please contact us immediately, and we can help you very quickly, even in a phone call. So call us now if you are in a similar situation. We can help you very quickly. You'll find the phone numbers on the top of the website. Critically ill patients in intensive care need time to recover, and intensive care teams are often not prepared to give critically ill patients the time and resources they need to recover. So what does that mean in detail? Unless you start asking the right questions and unless you start applying the right strategies and tactics, chances are that intensive care teams will start walking all over you without you even realizing that it's happening, or you only realize it when it's too late. Therefore, start asking better questions and apply strategies that I teach and that are proven to work. Next, if your mother will need a tracheostomy and can't come off the ventilator, you should definitely look into home care as a genuine alternative to a long-term stay in intensive care. What do I mean by that? For example, a service like intensive care at home is providing a genuine alternative to a long-term stay in intensive care for ventilated adults and children with tracheostomies. It's simply not true to say that only rich people can be looked after at home instead of intensive care. The way it works is as follows. An intensive care bed costs around $5,000 to $6,000 per bed day, and it's a bed that is very expensive. It's a bed that's very precious and in high demand. Intensive care at home, on the other hand, is providing a home care solution for half of the cost, and patients and their families can be in an environment where they want to be. Therefore, it's a win-win situation. And therefore, funding is often available from health insurances because they are saving hundreds of thousands of dollars, and intensive care units can free up one of their precious and in-demand intensive care beds. I know you want to have your mother breathing on her own, and if she can't breathe on her own, after about 2 weeks, she may need a tracheostomy. For now, keep referring back to the articles and video that I put links in, and then we'll get on the phone again and discuss the next steps. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly once your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision making fast once your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.